We have to take this COVID-19 situation and use it to move us in a positive direction for the provision of healthcare 2024, particularly women's healthcare.
Dr. Marjorie Dixon is advocating for changes in the way women's health care is done in this country. This coming after learning gynecology was originally not deemed an essential service at the beginning of the province's handling on COVID-19. Now that it is an essential service, Dr. Dixon says her practice is back in business, but not business as usual.
We have not resumed our elective surgeries yet. The emergent cases are still going through, so some of the cancer patients are going through, for example. Those people have, the very heavy bleeding that's being a threat or risk to life, that is going through. But the standard women's health things are not. And so it's very important, I think, I have a voice as a women's health advocate to say that I have a solution. We have solutions. We have these clinics where we have the ability to do minimally invasive surgeries and help with some of the backlog that comes from the hospital.
The idea is something that is being done right now in the state of New York.
Anything related to women's health care was considered an essential service, and service should continue to be provided so that patients could access it. And that was something that I was hoping we could do in this province. I was hoping we should do in our Canadian jurisdictions, because it's not saying, let's go back willy-nilly. And it's not also saying, let's occupy the hospitals where nurses have been redeployed to COVID floors. We're not saying that at all. We're saying, you know what, why don't we use our facilities to help with the backlog? It wasn't the traditional way of looking at things, but we have to be innovative.
City News asked Ontario's health minister about the issue today.
But we know that there are many people who have been waiting for these procedures for a number of months. They're very anxious about it. We want to make sure that we can start moving on that backload.
Dr. Dixon says this idea that is already being practiced in New York makes sense on two levels.
It is with less potential morbidity to the patients. They have less risk to the patients. They don't have to have a general anesthetic. They aren't necessarily being intubated in these out-of-hospital practices, so you don't have the risk of the spread of aerosolization in COVID-19, and it costs less to the province.
Dr. Dixon says she has reached out to the province and hopes that changes will come soon so that more patients can get the medical help they need. Brandon Rowe, City News.